The News Day continues. I'm Riza Diaz here to bring you the biggest stories we're watching now. Devotees continue to flock to the Santo Niño de Tondo parish ahead of the feast day on Sunday. So let's check out the latest situation on the ground with our news correspondent, JC Cosico. He's reporting live from Tondo. JC, how's the situation over there?
The first Mass here in Tondo Church is still ongoing. There are 11 Masses to be held until tomorrow, Feast Day, which is fewer than last year's 33 Masses. Church officials canceled the hourly masses and modified the schedule to give way for disinfection. Other health measures are in place for 300 individuals who will be allowed inside the church. Devotees are required to undergo the regular thermal scanning and disinfection. In anticipation of thousands of devotees, safety markers are placed outside the church to ensure physical distancing. LED monitors, meanwhile, have been installed for those who will not be able to enter the premises. At the Santo Niño de Pandacan, around 10 masses will be held beginning 4:30 a.m., lower than the usual 15 masses. Over in Barangay 95 Zone 8, images of Santo Niño were seen outside houses, including those donned in PPEs. However, the sight is far from usual as no street parties nor changes can be seen as these were earlier banned by the city government of Manila. Local officials have warned that violators will be apprehended. Riza, several roads near the churches of Tondo and Pantacan were closed to motorists, and devotees were told to monitor masses online. Back to you.
Thank you. That was JC Cosico reporting live from Manila City. Meanwhile, a municipality in Rizal is backing out from negotiations with a Chinese vaccine supplier. Let's know more about this issue. We have with us Cainta Mayor Keith Nieto on the phone. Mayor Nieto, good afternoon.
Good afternoon. Yeah.
Thank you, sir, for making yourself available for us this afternoon. Just a few questions. On a Facebook post, you announced that you will no longer be pushing through with the talks with this Chinese drug maker. We would like to know how long has this discussions been ongoing, and will you be able to name that a Chinese firm?
Okay, let's put it in the proper perspective. We've already signed up a confidentiality arrangement with AstraZeneca regarding the possible purchase of vaccines for the people of Cainta. Alongside that, and considering that we are not really that sure that we will be able to cover 100% of our population with the vaccines that shall be provided by Astra, I just thought it twice to entertain other prospects and meet up with a supplier of a Chinese sourced vaccine that could at least augment the vaccines that will be needed by my people. Upon posting that, there were a lot of reactions coming from the people who live in our town. And I just, when I was just going through it, I just decided maybe since there are actually 6 or 7 other options, maybe just to make sure that the vaccines that we shall be procuring will be rightly administered through the people who would wish to have that. I just thought of maybe putting this in the back burner and allowing other prospects or options to be considered as well. That is actually how it happened.
So those were the considerations that you had. And were there other reasons, Mayor, that you had to pull out for this possible deal?
No. Apart from that, it's actually a something that I just thought like the stakeholders by themselves are the ones who are making all those comments. And they have this right to know exactly which vaccines the LGU will be procuring, which will be administered to them. So I just thought like maybe we can come in clean by coming up with the vaccines which we can procure, which are generally acceptable to the people of Cainta.
Mayor, we understand that there is already a signed confidentiality clause with AstraZeneca, but we're hoping to get more details. Can you give us any?
But for now, there's actually a team who handles that for me. So I think we still have to close in on the particular provision that would at least allow me to put this in detail in public.
Mayor, how about the timeline on when do you expect the first rollout of COVID-19 vaccines?
I think there are several LGUs who have already inked the same deal with with us. No, I'm anticipating, as the way they said it also, that it's going to be available in the third quarter of the year. But alongside, if there would be other prospects, other options that would have a faster way of delivering it to us, or the availability would be fast earlier than what ASA can offer, we will also consider it. I think the bottom line here is the LGU will always be ready with the funding that shall be needed to procure it immediately as soon as the vaccines are made available to the public and to the LGU.
Since you mentioned funding already, we want to know your insight under the national budget, Mayor. We have more than 70 billion pesos allotted for the vaccine procurement. Do you think this is enough?
I wouldn't really know, because it would all depend on the kind of vaccines and the pricing of the vaccines that shall be procured by the national government. But of course, we also work on the premise that there would be, in the event that there would be not sufficient assistance coming from the national government, that is the LGU on its own should be able to have adequate funds that is cover its people.
All right, Mayor Nieto, thank you very much again for joining us this afternoon. That was Cainta Mayor Keith Nieto. Meanwhile, the Commission on Human Rights is calling on the government to ensure that all Filipinos have equal access to vaccines. CHR Commissioner Gwendolyn Pimentel-Gana says COVID-19 vaccines must be accessible to residents from both urban cities and far-flung areas. The Commission notes that there are local governments with a high rate of infected residents that may not have enough resources to secure quality vaccines. Pimentel-Gana adds that the government must also assure Filipinos of the effectiveness of shots under the vaccination program. Vaccine czar Carlito Galvez earlier said that Pfizer or Moderna vaccines, which have high efficacy rates, can only be deployed in major urban centers with cold storage capabilities. More stories after this short break. Stay with us. You're still watching One News Now. I'm Riza Diaz. The number of COVID-19 cases in the country is now nearing 500,000, with more or less 2,000 new cases being registered daily. Are we already feeling the impact of the new variant, and the gathering of the thousands during the Feast of the Black Nazarene has an effect? To answer this, questions and more, we have with us Professor Guido David from UP Octa Research Group. Professor David, magandang hapon po. Professor David, good afternoon.
Yes, hi, good afternoon.
Sir, good afternoon. We are already seeing a steady increase in the number of new infections in the country. So to what factors can we attribute this?
The increase that we're seeing now is mostly due to the holiday delay. So what happened during the holiday was 40% of testing was decreased. Or in other words, we were only testing about 60% of what we normally test. This happened from December 25 until about January 3. So as a result of the reduced testing, we were only getting about half of the number of cases that we were supposed to get. And once the testing resumed to 100%, the number of cases increased again. So during the holidays, the number of cases per day was down to about 1,000 or less. Now we're getting about 2,000, which is more or less expected with the testing that we're having now. So most of it is due to the holiday, not due to the translation effects yet.
Okay, so you would agree with authorities, sir, that authorities, they're saying that physical distancing, since it was observed during the Feast of the Black Nazarene, it has nothing to do with the numbers.
Actually, I would be cautious still because it normally takes about 1 to 2 weeks before we see an effect. So after the event, it takes usually about 1 to 2 weeks before we see an effect in the number of cases. And we might still see an increase in the number of cases by next week, but we're not sure. So if we don't see an increase, then probably the social distancing that was put into effect was actually effective, and that would be good news for us.
Sir, just last Wednesday, health officials confirmed that they detected the new variant in the country. How threatening is this?
Well, the new variant is very concerning, of course. Part of the changes in the new variant only issued the travel ban once we found out about the new variant, which was around December. So it was most likely already here. In fact, we're seeing signs of it that it's here already, but we're not seeing it in in volume here yet, or based on the limited testing that we conducted, we didn't see actually any evidence or any proof that it was already here based on the testing, but we're seeing evidence that it's here based on testing in other countries. When, for example, our people go to other countries and they are tested with this new variant. So it's concerning, but we don't know how much of it is already in the country, and it might not be a lot.
All right, thank you for your insights, Professor Guido David from the UP Octa Research Group. Now for more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Cignal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.